If you've been watching the Ozempic conversation and wondering whether it actually applies to you, whether the results you're seeing other people get are realistic for your body, this video is for you. Because it turns out Ozempic and the class of drugs it belongs to, GLP-1 receptor agonists, do not work the same way in women as they do in men. And the differences are significant enough that they change what you should expect, what you should know before you start, and what nobody in the mainstream conversation is telling you. I'm going to break down what the research actually shows about how these medications affect the female body specifically, including something that has caught a lot of women completely off guard. Let's start with the weight loss itself. In clinical trials, women consistently lose more weight on semaglutide than men do. Not a little more, significantly more. Women on semaglutide lost an average of 11% of their starting body weight. Men lost around 7 to 8%. In trials of tirzepatide, the next generation of the same drug class, women lost up to 28% of starting body weight. Men lost up to 19%. That's not a small gap, and researchers are still working out exactly why it happens. Part of the answer is hormonal. Estrogen appears to enhance how GLP-1 drugs work in the body. It improves insulin sensitivity and may amplify the appetite-suppressing effect of the medication. Women's bodies, in other words, may be more responsive to the mechanism of action. Part of it is body composition. Women tend to carry more subcutaneous fat, the fat just under the skin, rather than visceral fat, which sits around the organs. GLP-1 drugs appear to be particularly effective at reducing subcutaneous fat, which may be one reason women see larger reductions in overall body fat percentage. And part of it is dosing. Women tend to weigh less than men on average, but are prescribed the same doses. This means women are effectively getting a higher dose relative to their body weight, which likely contributes to stronger effects, both in terms of results and side effects. Speaking of side effects, this is where being a woman on these medications gets more complicated. Women report significantly more gastrointestinal side effects than men. Nausea, vomiting, constipation, and stomach discomfort are more common and often more intense in women, especially in the first few weeks. This isn't random. It's related to the fact that women already have slower gastric emptying than men on average, and GLP-1 drugs slow it further. The practical implication is that women often need to titrate up more slowly, stay on lower doses longer, and be more deliberate about meal timing and portion size, especially early on. But the side effect most women are not warned about is this. The medication can significantly reduce the effectiveness of your oral contraceptive. Ozempic slows gastric emptying, the rate at which your stomach empties into the small intestine. This affects the absorption of oral medications, including the pill. Blood levels of the hormones in oral contraceptives drop when taken alongside GLP-1 drugs, which means ovulation suppression can be incomplete. The FDA updated Ozempic's labeling in 2023 to include a recommendation for backup contraception, but this message has not reached most women taking it. The consequence has a name now: Ozempic babies. Thousands of women who had been on oral contraceptives for years, some who had struggled with fertility and believed they were unlikely to conceive, became pregnant unexpectedly while on semaglutide. The increased fertility is real, and the oral contraceptive interaction is real, and most women find this out the hard way. Now let's talk about what GLP-1 drugs actually do to the female hormonal system, because this is where the conversation gets genuinely interesting. The most well-studied hormonal benefit is in women with PCOS, polycystic ovary syndrome. PCOS is driven largely by insulin resistance and elevated androgens, male hormones that are present in small amounts in all women, but elevated in PCOS. GLP-1 drugs reduce insulin resistance and lower androgen levels, which addresses the root hormonal driver directly. A 2023 study found that 63% of women with PCOS who took semaglutide restored regular menstrual cycles within 6 months. In the diet-only comparison group, that number was 12%. For women who have spent years dealing with irregular cycles, no cycles, or cycles that were painful and unpredictable, that's a significant finding. But the effect on menstrual cycles isn't limited to women with PCOS. Many women without a PCOS diagnosis also notice changes in their cycle on GLP-1 drugs. Sometimes improvement, sometimes disruption. And the reason for this comes down to something that is rarely discussed. Fat tissue produces estrogen. When you lose weight rapidly, your body's estrogen production drops because some of that estrogen was coming from fat cells. This can cause temporary hormonal disruption, irregular periods, heavier or lighter bleeding, or cycles that shift in timing. This is not a sign something is wrong. It's a predictable biological response to rapid body composition change. The disruption is usually temporary and resolves as weight stabilizes. But it's something every woman should know about before starting these medications, because it can be alarming if you're not expecting it. There is one more thing I want to address, and it's the question that doesn't get asked enough. GLP-1 drugs are extraordinarily effective at suppressing appetite. More effective than most people expect. For many women, this is experienced as relief, finally not being driven by constant hunger, finally having a different relationship with food. But some women experience it differently. The appetite suppression can be so complete that eating becomes difficult, that food loses all appeal, and that getting in adequate nutrition, enough protein, enough calories, becomes a genuine challenge. This is not just an aesthetic concern. Severe caloric restriction, especially without adequate protein, causes muscle loss alongside fat loss, which has long-term metabolic consequences. The women who do best on these medications are the ones who approach them as a tool for building better habits, not as a passive solution. Using the reduced appetite to establish consistent meals, prioritize protein, build a movement routine. The drug creates a window. What you do in that window determines the long-term outcome. The research is consistent on this. Women who combine GLP-1 medications with strength training and adequate protein intake preserve significantly more muscle mass than those who don't, and maintain better metabolic health both during the treatment period and after. Because here's what is also true. Most people eventually come off these medications, either by choice or due to cost or because of side effects. And when that happens, appetite returns. Weight often returns. The research suggests that without lifestyle changes, most people regain a significant portion of the weight within a year of stopping. The medication works, but it works best as a starting point, not a permanent solution that operates independently of everything else. So what does this mean practically if you're a woman considering these medications or already on them? First, the results you're seeing in women online are real. Women do respond more strongly to GLP-1 drugs than men on average. The weight loss is real. The hormonal benefits are real. And for many women, this medication is genuinely life-changing. Second, if you are on oral contraceptives and starting a GLP-1 drug, talk to your doctor about backup contraception before you start, not after. This is not a theoretical risk. It is a documented risk that has caught thousands of women off guard. Third, expect more GI side effects than the average clinical trial result suggests. Go slowly. Give your body time to adapt. The women who drop out of these medications most often do so because they pushed through the dose escalation too fast. Fourth, protect your muscle. Prioritize protein at every meal, minimum 20 to 30 grams every time you eat. Consider adding resistance exercise or strength training, even light, even just body weight, even just twice a week. The fat loss will happen. The muscle preservation requires intention. Fifth, if you have PCOS or have been told you have irregular cycles, elevated androgens, or insulin resistance, GLP-1 drugs address several of the underlying mechanisms simultaneously. The hormonal improvement isn't a side effect. For many women with PCOS, it's the most meaningful change. And finally, whatever your reason for considering these medications, weight, energy, hormones, fertility, metabolic health, go in with accurate information, not Not the version you see on social media, not the version your friend had, the version that accounts for what your body actually is and how it actually works. Because the gap between how these drugs work in women versus men, the interaction with contraception, the temporary hormonal disruption, the importance of muscle preservation, these are things you should know before you start, not things you discover 6 months in. You deserve the full picture, not the simplified one. I'll be back with another video soon. Please note, this video is for educational purposes only and is not medical advice. GLP-1 medications require a prescription and medical supervision. If you're considering them, talk to your doctor about whether they're appropriate for you.